So when we have certain illnesses, we normally find out what is the root cause of that illnesses. But same exactly as the Ayurveda. In Ayurveda, we go to the systematic roots of the problem, and similarly in music therapy, we go to the roots of what exactly illness has become or how much turn it might take. Hello everyone, namaste. Welcome to this series of music therapy. I am Dr. Shambhavi Das. I am a musician. I am a music therapist in my center, Demi Center for Music Therapy, which is in Gurgaon. And I heal the people suffering with mental abilities through music therapy and the sound healing. So today we will discuss about what is music therapy and sound healing. So there's a difference. So as the name indicates, music therapy means that when you treat someone, when you cure or when you heal, when you give the therapeutic aspects of anything, of the disease, illnesses through music. So music and the sounds. So music, when we talk about music, then music means particular tunes. And when we talk about sounds can be anything which can be noise also, which can be soothing sounds also. So it depends upon the music therapy. So we will discuss about how we heal through music. And so we basically, now your question would be that music is anyways healing. It's very relaxing and it actually soothes our brain and mind and the soul. And I think there are very less people who don't like music. Normally everybody resonates with musical sounds and tunes. So my answer to this is that yes, it is very relaxing, but when we treat certain illnesses, then we have to go to a certain frequency. So frequency or frequencies. So our body is actually in the full universe and everything is vibration, sound vibration, and we all are made up of the reverberation of frequencies. So when we have certain illnesses, we normally find out what is the root cause of that illnesses, but same exactly as the Ayurveda. In Ayurveda, we go to the systematic roots of the problem, and similarly in music therapy, we go to the roots of what exactly illness has become or how much turn it might take, how much it can be furthered more to different areas. So this is how we normally try to understand that what is the problem, what is the root, and what are the related frequencies through which we can cure a person. So this is one aspect. So similarly with the sounds also, sounds means something like there are two kinds of sounds, naad in music, ahat naad, anahat naad. So ahat means certain sounds which जिसकी हमें आहट है, or we can say the sounds which are soothing and which we are able to hear, which we are able to listen. There are certain sounds which are anahat. Anahat means which are there in our universe, in our body, but we are unable to hear. For example, the sound or the vibrations of the blood. When the blood flows, you can't say that you can't listen to its voice. So that is the anahat naad. But the naad which we can listen, ahat naad. So there are many sounds which we can listen. So this is the main purpose of anybody to understand that what is music therapy and sound healing is all about. Now in music therapy, how do we treat? So patient is sitting and normally we can use a headphone or we can just have a little vibration of room a typical, we can just have an empty room and we make a patient or a client to just sit back and listen to the sounds. This is the initial part. Then we have certain steps that when he has listened to the music for 20 minutes or something, then we normally ask the patient to write it down. What is his or her perception? What did he feel? And did he feel good? So then we normally change the interventions. So when we apply certain techniques in music therapy, we call that intervention. Means music therapy interventions. Means that we are able to make a person listen to a sound. Now, there are many kinds of music therapy. Receptive music therapy is one, that is listening to the sounds. That is when you are listening. It can also be called passive music therapy, means you are just listening. Passive because you are listening, so you might get distracted. Like for 2 minutes you listened, you heard a sound and then your thoughts came on. So that is passive. Then we have the applicable music therapy. The application means I am asking the patient or the client to sit and sing with me, or to play with me, or to dance with me. Music has three aspects: singing, dance, and playing the instrument. So there are three kind of which we call in spectrum we call music. So we can apply anything depending upon the client's preference, the background, the musical background, and depending upon what kind of illnesses a patient has.